Hi, so my name is Leonard Bennett. I am a PharmD, a graduate of Mercer University College of Pharmacy, 1989. And currently my role is a principal director at EMD Serono, which is the healthcare division of Merck KGaA, Darmstadt, Germany. I work with the payers and the health systems in the U.S. Healthcare landscape to help educate and make formulary decisions regarding our products. So I work in the area of oncology, neurology, immunology, and fertility. I truly feel like I am the person that gets to go in and represent those patients who really need access to medications. I take this job very seriously in the fact that we know that there's a lot of barriers that are put in front of patients when they're trying to obtain drugs at the right cost. And so I get to have those discussions to help remove some of those barriers so the patient is able to receive their drug at the right time and hopefully at an affordable price. So I've always been very interested in medicine. As a child, I was a severe asthmatic. So I always tell people, the patients who suffer with asthma today are very blessed to have nebulizers and inhalers, because in my day, it was a hospital visit and that was it. So, so as the advances in asthma came along and, to take a cough syrup that prevented you from going to the, or a syrup that prevented you from going to the ER, and then a tablet, or inhaler, it was a huge advance for me because, a lot of my childhood was spent in the hospital. And so I just was very interested in how something so small can make such a big difference in life. And so from there, I've always been interested in the sciences, biology, chemistry. And so it was a decision of pharmacy versus medicine. And, I chose pharmacy, which I'm very glad I did. But it's just the advances that we have today. When you look at like gene therapy and CAR-T therapies and, diseases that were fatal, it's just been so interesting to see where the advances in medicine have come. In my postgraduate era was HIV, and it was basically a death sentence. And today it's just a chronic disease that everybody can live with. I loved the small atmosphere, the family atmosphere you get at Mercer. I really like that, it's a family. My friends that I met here, I came to pharmacy school not knowing anyone, and I left with lifelong friends. My friends and I today still take trips together. 35 years, 40 years post-grad, we still get together. So I felt like Mercer was a school that gave you a lot of opportunity to grow as a pharmacist, but also gave you a lot of exposure to the different types of pharmacy you may practice. For me, it was the professors that really take an interest in the students and really get to know you personally. I had a major car accident when I was a student at Mercer, and the professors were like family at that point. They were very accommodating. I couldn't write. I had to take exams verbally. But not only they really made sure I was okay. Not only from a pharmacy student perspective, but as a human, to make sure I had everything I need to get through the quarter and graduate on time. Mercer was a very good decision for me, and I was a young kid basically making a lifelong decision, and it's one I never regret. It's provided me a great life and a great profession and opportunity to do things I never would have thought I'd been able to do.